So here's a really general overview of how to give report in the ICU. And it can seem really daunting the first few times that you're having to do it on your own, but it's actually really simple. So I've broken it down into two sections. There's general information, which is what you'll start off with, and then you'll move into body systems. So starting with general information, that would include information like the patient's name, their date of birth, their weight, their admitting diagnosis, their pertinent health history, and the plan of care. It would also include if they're on any sort of isolation precautions and what team they're on. And following general information, you go into body systems. And starting with neuro, working your way down, you'll cover all of these sections. So with neuro is your neuro assessment. So is the patient alert and oriented ×3? What's their level of consciousness? Are their pupils equal round reactive to light? Are they sluggish, non-reactive? Are they on any sort of narcotic drips? If so, what is the dose for those things? Have you given any PRN medications? When was the last time you gave those? Is the patient moving all their extremities? These are all included in neuro, along with any sort of information about if they've had stroke or an abnormal EEG. Anything that's pertinent to the history that needs to be included in body systems is obviously covered, but this is just a general overview. The next section is CV, which is cardiovascular. In this section, you'd include whether or not the patient is febrile, if they're afebrile, what their heart rate range has been, what their blood pressure range has been. If they have an arterial line, you want to say whether or not it's correlating with their cuff pressure, and if the art line waveform is normal. Is the patient warm and well perfused? What is their capillary refill? And if they're on any antibiotics, what antibiotics are they on and for how long? Also in this section, you can include what your IV access is. So that would include all of your peripheral lines as well as your central lines. And you would also want to say what is running through those things as well. The following section is respiratory. And this is in the ICU, usually a pretty big area to cover because a lot of the patients are ventilated. So I like to leave a lot of room to write. And if your patient does have a breathing tube or an ET tube, you'd talk about what the size of the ET tube is, what it's taped at, how far you suction down, what the ventilator settings are, and if there's been any changes to those, what percentage of oxygen they're on, if they're on any respiratory treatments, what the respiratory treatments are, what their breath sounds are they working hard to breathe, do you notice any retractions, so on and so forth. And then GIGU is the next section. So that covers everything related to what their feeding is, if they have an NG tube or a G tube or an OG tube, are they getting bolus feeds or continuous feeds, what their bowel sounds, are they stooling, what is their urine output? If they have a Foley, you can obviously go back to look at your eyes and nose to see what their fluid status is, to see if they're dehydrated or overhydrated or just right at the right spot. If they're on any sort of bowel regimen, that's included, and anything pertinent to those areas, if they're on diuretics, so on and so forth. And then skin is the next section. And so you'd want to talk about if there's any sort of wounds, if there's any sort of dressings on these wounds, if there's been a surgical incision, what the surgical incision looks like, what the dressing looks like, what the skin surrounding that area looks like, if there's any sort of pressure ulcers, or anything that we really want to watch out for that might be starting to break down, and any sort of special wound care that we're doing or topical ointments or creams that we're using like hydrocortisone, that's all included in skin. And then the last section is psych-soc, and this is the patient support system. So any names of important family members, or if social work is involved, if the patient's family has extenuating circumstances that we should be aware about, that's all included in this section, as well as abnormal things like whether or not the patient, might be like let's say CPS is involved. That would be mentioned in psych-soc. So hopefully this gives you guys a better general overview of how to give report in the ICU. Thanks for listening.